This is excellent advice because parents, if your daughter keeps getting a sore or red vulva, it might all be to do with the way that she wipes. So you can teach her to wipe in the proper way, potentially reversing vulvovaginitis. So first, why does it matter? Well, kids, especially girls, are way more prone to vulvovaginitis, and that's irritation or inflammation around the vulva. You might see that because they're red, they're sore, they're itchy, they're irritated. It's super common between the ages of 3 and 10, and it doesn't mean they've got an infection. Although it's commonly misdiagnosed, you might try using antibiotic creams or thrush creams, but actually it's probably the result of incorrect wiping, like wiping from back to front or not wiping at all, or just there being some lingering moisture because they're in a nappy or they're not wiping that moisture away and their underwear become wet. Also, bubble baths or wearing very tight clothing or perfumed soaps can all trigger vulvovaginitis. So how should we teach them to wipe right? Well, ultimately, the first step is to teach them to wipe from front to back. You can use the phrase from the front where you pee to the back where you poo. And understanding where they should be wiping by using these stickers can really help to mimic that motion so they get used to it. By wiping from front to back, it avoids dragging the bacteria from the back, from the bum, towards the front where the vulva is and where the urethra is, because otherwise it can cause irritation and UTIs. They should be using soft and unscented toilet paper. You don't need to use any wipes or perfume stuff, just gentle, plain toilet roll. And also make sure that they wipe until it's clean. So teaching them to check the paper and then wipe again if needed is really helpful. Tell them to take their time and no rushing. Then baths. Think about what you're washing them with. Bubble bath, scented soap and body wash can all irritate that delicate skin, so stick to water or a gentle non-perfumed wash, or even wash with an emollient cream. That's all you need. Finally, check the nature of their underwear. Use cotton pants that are loose fitting. Avoid tight synthetic material, so if they are going swimming, they shouldn't be sitting in that swimming costume all day long. Wearing breathable cotton is best, and make sure they're changing their underwear daily. Vulvovaginitis is rarely serious and it doesn't need antibiotics, and young girls very rarely, if ever, need thrush treatments. Most of these cases clear up with good hygiene and avoiding any irritants. But if they do have symptoms that persist, or there is discharge or pain or a bad smell, you should get checked. Let's raise a generation who know what a vulva is and how to care for it properly.